got you updated. This is Radio Manzi News in English.
You are tuned to Radio Imanzi, broadcasting from Kigali. Here is the news in English, brought to you by Fiona Umuganwa. The headlines. President Paul Kagame presided over the groundbreaking of BioNTech's initial African modular mRNA manufacturing facility in Kigali. His Royal Highness the Prince of Wales paid a visit to one of Arcos's sites to witness a collaborative landscape restoration for climate resilience in Rwanda. Prime Minister Edward Ngirente has reminded Commonwealth government and business leaders of the need for innovative ways to access climate financing and carbon market to achieve the community's goals. Now, news in detail. President Paul Kagame this morning received Boris Johnson, the Prime Minister of the United Kingdom. According to the Office of the President, the two leaders held talks on existing partnerships between Rwanda and the UK, including the recent migration and economic development partnership. The Premier convened along with the Prince of Wales and Duchess of Cornwall in Rwanda on the occasion of the official opening of the high-level meeting. And later, President Paul Kagame presided over the groundbreaking of BioNTech's initial African modular mRNA manufacturing facility in Kigali, based on the BioNTech modular system. The president was joined by President Nana Akufo of Ghana, President Afan Ali of Guyana, BioNTech CEO, Chairperson of the African Union Commission, Musa Faki Mahama, Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization, and the Senegalese Foreign Affairs Minister, among other stakeholders. President Kagame said that the facility will work closely with a plant being established in Ghana to ensure a complete end-to-end production chain in Africa.
Vaccine manufacturing requires advanced regulatory capability as well as a highly skilled human capital. I'm happy to announce that Cabinet has approved the establishment of the African Biomanufacturing Institute, which will provide training and qualification for this industry. We expect that this facility will work closely with a plant being established in Ghana to ensure a complete end-to-end production chain in Africa under the close supervision of both our regulators. This ceremony is a result of the African Union's decision last year to take action on vaccine inequality. Chairperson of the African Union Commission, I thank you for your tireless effort to make this happen. This facility is one of 3 identical sites planned by BioNTech in line with the strategy, including Senegal and South Africa. So really a big thank you to everyone who has played a critical role in getting us to this point. This is just the start, but a big start.
Today, BioNTech welcomed its African partners for the first time on the African continent as construction works for the initial African mRNA manufacturing facility began, with a target for the first set of manufacturing BioNTech to be delivered to the site by the end of 2022. The President of the Republic of Ghana noted that this groundbreaking BioNTech ceremony confounds those who secretly doubted the project to bring boost to Africa's capacity to be self-reliant in the production of vaccines.
When we met in Marburg in Germany some 4 months ago, there were some who secretly doubted our resolve to bring this all-important project, which will boost Africa's capacity to be self-reliant in the production of vaccines, to fruition. I'm happy we have, with today's event, been able to confound these doubting Thomases. I'm grateful to my senior and good friend, the redoubtable President of the Republic of Rwanda, His Excellency Paul Kagame, for inviting me to participate in this great groundbreaking ceremony and to signal to the rest of the world the commencement of this end-to-end vaccine manufacturing facility involving Rwanda, Senegal, and my own country of Ghana.
The Rwandan facility, with a size of about 30,000 square meters, will be initially equipped with 2 biocontainers, one for the production of mRNA and one for the production of the formulated bulk drug product. The biocontainers will be equipped to manufacture a range of mRNA-based vaccines targeted to the needs of the African Union member states, which could conceivably include the Pfizer-BioNTech COVID-19 vaccine and BioNTech's investigational malaria and tuberculosis vaccines. The estimated initial annual capacity of, for example, the Pfizer-BioNTech COVID-19 vaccine will be about 50 million doses. Manufacturing in the biocontainers in Rwanda is expected to commence approximately 12 to 18 months after their installation. The President of the European Union Commission, Ursula, said the Vaccine Equity for Africa project is part of a larger African ambition that will see 60% of the vaccines used on the continent are manufactured on the continent by 2040.
Earlier this year, we launched the Vaccine Equity for Africa project at the BioNTech headquarters in Germany. And today, just 4 months later, we're jointly laying the foundations for the first mRNA vaccine production facility in Africa, here in Kigali. We are turning a simple but groundbreaking idea into reality in record time. Our partnership will bring vaccine manufacturing in Africa to the next level. This would not be possible without our mutual dedication, cooperation, and vision. The Vaccine Equity for Africa project is part of a larger African ambition. By 2040, the African Union wants that 60% of the vaccines used on the continent are manufactured on the continent. And the European Union fully supports this plan. The common aim is to build a pan-African value chain for vaccines and other pharmaceuticals. Here in Rwanda, but also in Senegal, in South Africa and in Ghana, all champions of innovation on the continent.
BioNTech supports the International Paris Agreement Treaty on Climate Change. To this end, the company is committed to operate its African manufacturing sites, including the initial plant in Rwanda, on a climate-neutral basis using renewable energy. Izuba Energy will work to facilitate supply of the site with renewable energy. His Royal Highness the Prince of Wales paid a visit to one of Arcos's sites to witness a collaborative landscape restoration for climate resilience in Rwanda. For many years, Prince Charles has been dedicating his efforts for the fight against climate change and biodiversity loss. In that context, the Prince established the Circular Bioeconomy Alliance, CBA, under his Sustainable Markets Initiative to accelerate the transition to a circular bioeconomy, aiming to place nature and people at the heart of a global circular bioeconomy. Since 15th June 2022, Arcos became a member of the CBA with the aim to facilitate the integration of a circular bioeconomy in its focal landscapes. Arcos's approach in landscape restoration involves communities through a long-term partnership cemented by the Sustainability Agreement, using an integrated approach to restore degraded ecosystems and enhance human well-being. The Prince was welcomed by Honourable Minister of Environment, Dr. Jean-D'Arc Mujawamadia, together with Arcos's Executive Director, Dr. Sam Kanyamibwa. The Minister of Environment says the landscape restoration is a major priority for the government, and Rwanda values the role of communities as well as the contribution from civil society organizations. His Royal Highness visited a tree nursery managed by a local community cooperative. He was impressed by the diversity of tree species produced, including agroforestry, fruit and indigenous tree species, and the inspiring knowledge and skills of farmers in the tree nursery development and management. He appreciated that the community integrate indigenous tree species in the nursery, as well as their farms, which is an important aspect in landscape restoration. On this afternoon, President Paul Kagame, alongside Prince Charles and Commonwealth heads of government, attended the Kigali Summit on Malaria and Neglected Tropical Diseases held at Mrna Conference Arena. The summit presented an opportunity for world leaders to demonstrate their commitment to ending malaria and NTDs, causing untold suffering and misery to billions of people worldwide. The fight against these debilitating diseases is a crucial component in unlocking countries' potential to build a better world for all. It was observed that investment in malaria and NTD programs leads directly to more resilient health systems, better pandemic preparedness and prevention, and healthier populations. President Paul Kagame said this week the Commonwealth will commit to working towards ending the malaria pandemic by 2030.
This week, the Commonwealth will commit to working towards ending the malaria pandemic by 2030. We will need your support to make this happen. One key action item is to support the Global Fund's 7th replenishment. Today, we are also endorsing the Kigali Declaration on Neglected Tropical Diseases. Alongside the WHO's Neglected Tropical Diseases Roadmap to 2030, we have a clear action plan. I am pleased that the WHO has recently confirmed that sleeping sickness has been eradicated in Rwanda. But we still have much more to do. Ensuring that all African countries mobilize the domestic financial resources required for quality health care is a priority for the African Union and our partners. If there is one thing the pandemic has taught us, it is that together, through coordinated and collaborative action, we can achieve much more.
Prince Charles said while much has been achieved in the malaria campaign since 2000, due to the COVID-19 pandemic, there remains a great amount to do if the ambitions are to be made.
While we have achieved so much in the malaria campaign since 2000, I'm afraid that largely due to the COVID-19 pandemic, there remains a great amount to do if our ambitions are to be met. I can only hope, therefore, that today's meeting signals the necessary focus and prioritization of funding for novel therapeutic, prophylactic, and vaccine strategies against malaria. For example, I understand that the Global Fund to Fight AIDS, Tuberculosis, and Malaria reported that 188 million mosquito nets were distributed in 2020, a 17% increase compared to 2019, despite COVID-19. And there is a wider hope. We now have more valuable assets at our disposal than ever before. For example, the first WHO-approved vaccine, new nets, and modern communications tools to monitor our progress and fight against complacency. As we emerge from the pandemic, 2022 must be a turning point. Post-COVID-19, the world is paying greater attention to infectious diseases, and we must capitalize on this to provide proper support to prepare for and respond to infectious disease outbreaks. It is most encouraging to see that leaders of the Commonwealth will discuss and pledge their support for this campaign and are committed to work towards ending the epidemic of malaria by 2030. I very much welcome this determination and that we are not turning our back on a job unfinished.
Philanthropist Melinda Gates, the co-chair of the Gates Foundation, called on world leaders to take two important actions. One, to endorse the Kigali Declaration on Neglected Tropical Diseases, and second, asking everyone to increase their commitment to the Global Fund.
We're calling on world leaders to take two important actions. One, we're asking everyone here in this room to endorse the Kigali Declaration on NTDs. By 2030, we can eliminate NTDs in 100 countries. And second, we're asking everyone to increase their commitment to the Global Fund. If the Global Fund hits its $18 billion target, if the Global Fund hits its $18 billion replenishment target, malaria cases will fall by 2/3 by 2026. With this support, Africans and their partners can accelerate health R&D. They can use the smart tools and systems they have to track diseases and deliver treatments tailored to each community. They can strengthen the primary health care systems that save lives. And through it all, in the spirit of Dr. Mele Chela, we can make sure that the focus stays on those who are too often left behind.
The Kigali summit convened some of the most influential voices in global health, including world leaders, leading World Health Organization figures, philanthropists, scientific experts, global influencers, and community champions. The summit culminated with a call to action focusing on the specific actions needed to end malaria and NTDs once and for all. The Canadian Prime Minister Justin Trudeau today visited the Kigali Genocide Memorial in Gisozi to pay respect to the victims of the 1994 genocide against the Tutsi. The Commonwealth leaders, health professionals and civil society made for a special event to mobilize a Commonwealth-wide awareness campaign and policy interventions to tackle mental health challenges post-COVID-19. In attendance was the Commonwealth Secretary-General, the Right Honourable Patricia Scotland, the First Lady of Rwanda, Her Excellency Janet Kagame, the Rwandan Foreign Affairs Minister, Honourable Dr. Vincent Biruta, Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization, advisor to the World Health Organization and Director General on Mental Health and Autism. They were joined by Commonwealth ministers and dignitaries, civil society and mental health experts from across the Commonwealth. The Commonwealth Secretary-General, the Right Honourable Patricia Scotland, said the discussion could not be more timely or more important. This is especially important after 2 years of lockdown and disruption. There is no doubt that challenges associated with mental health have been amplified by the pandemic, and a huge amount of work remains to challenge stigma, break down barriers, and provide essential support services. The First Lady of Rwanda said it goes without saying that mental health transcends the health domain. Poor mental health breaks down our communities by disrupting the wellness of families, poisoning our socio-economic development. She says there is no brightness in our shared future without mental health, and there is no Commonwealth without common mental health. The World Health Organization Director General said COVID-19 has highlighted the gaps in the capacity of health systems around the world to address mental health conditions. Investment in the mental health remains low and the stigma surrounding it remains high. Now, as many countries work to resume services, there is an opportunity to build back better by scaling up the provision of community-based mental health services and integrating mental health into primary health care as part of every country's journey towards universal health coverage. He noted that the links between mental health and public health, human rights and socio-economic development mean that transforming policy and practice in mental health can deliver real substantive benefits for individuals, communities and countries everywhere. The event follows continued calls for the global health community to address the rising global burden of mental health that has been exacerbated during the COVID-19 pandemic, with lockdowns, global conflicts and economic hardships having substantially increased mental health conditions, particularly among young people, women, children and health workers. The Prime Minister of Rwanda, Edward Ngirente, has reminded Commonwealth governments and business leaders of the need for innovative ways to access climate change financing and carbon market to achieve our goals. The Premier was speaking at the Commonwealth Heads of Government high-level site event on climate change. He says there is a lot Commonwealth member states can do together to achieve the goals of the Paris Agreement. Many Commonwealth members, particularly developing states, are especially vulnerable to a warming world. The larger economies are major emitters and have much work ahead to reduce emissions. He said that this puts the Commonwealth in a unique position to work together and deliver a common future that is clean, green and climate resilient. Last year, the world delivered the Glasgow Climate Pact and numerous multilateral agreements on forests and financing. But with emissions continuing to rise, it is clear that there is a whole more needed to be done. He disclosed that there will be a discussion on how vulnerable Commonwealth nations can benefit from mechanisms like the carbon market. Carbon credit on carbon market is a permit which allows a country or organization to produce a certain amount of carbon emissions and which can be traded. The carbon market would allow nations to finance carbon cutting projects in other countries and count the avoided emissions towards their own climate targets. At a special event coinciding with the Commonwealth Heads of Government meeting, the Commonwealth Secretariat and the No More Foundation were joined by Her Royal Highness Duchess of Cornwall for the launch of new guidelines for the 54 Commonwealth countries to stop and prevent violence against women and girls. The Commonwealth and No More's new guidelines recommended whole system approach strategy to help end violence against women and girls and improve gender equality, urges more consistent and effective collaboration between governments, civil society and the private sector. The effort builds on Commonwealth Says No More initiative, first launched in 2019, and comes at a critical time in the wake of the dramatic surge in domestic and sexual violence during the COVID-19 pandemic. Her Royal Highness the Duchess of Cornwall said, "In the strength of unity, the women and men of the Commonwealth stand with victims and survivors who, despite the temptation to hide away in silence, speak up so that others know they're not alone, whether in Africa, Asia, Europe, the Pacific or the Caribbean and Americas." The Commonwealth Secretary-General, the Right Honourable Patricia, noted that violence against women and girls carries a profoundly negative impact on their participation in education, employment and civic and undermines poverty reduction. The Commonwealth heads of states and governments are said to adopt the Living Lands Charter. This proposed charter was conceived following the 2019 Intergovernmental Panel on Climate Change Special Report. Leaders and senior officials from across the Commonwealth have voiced their support for the charter during a high-level breakfast event held in the margins of the ongoing Commonwealth Heads of Government meetings. Honourable Patricia Scotland, the Commonwealth Secretary-General, said tens of millions are affected by climate change. They know that without their action, the force and frequency of violent weather is going to overwhelm them. Commonwealth spans the globe and includes both advanced economies and developing countries. 32 of the members are small states, many of which are island nations. The Prime Minister of St. Lucia, Honourable Philip Jean-Pierre, said the Commonwealth call for action and Living Lands Charter is a step in the right direction, building resilience and protecting biodiversity. The Prime Minister of Tonga also called for financial support in order to achieve the implementation of the targeted goals. The event also included statements from ministers of Botswana, Guyana, Namibia, Nigeria, Rwanda and Zambia, along with leaders of international partner agencies such as the United Nations Convention to Combat Desertification, United Nations Institute for Training and Research, Green Climate Fund and International Solar Alliance. On the other hand, Australia has provided $2 million Australian dollars as a contribution to support the Commonwealth Climate Finance Access Hub, headquartered in Mauritius. Under the call to action on Living Lands, the hub will unlock vital financial and capacity building support for projects linked to climate-smart agriculture, soil and water conservation, green cover and biodiversity, livestock rearing, engaging indigenous people and climate-resilient development.
Some items of international news on Radio Imanzi.
Welcome back. Tanzania has said it would tackle illegal immigrants in the northern eastern area of Loliondo, where it has alleged Kenyan Maasai pastoralists are supporting opponents to a planned wildlife protection area. The Maasai of Loliondo have accused the government of trying to force them off their land in order to organize safaris and hunting expeditions. But the government has rejected these accusations, claiming that it wants to protect 1,500 square kilometers of land from human activity. It says it is just a fraction of a region that covers 4,000 square kilometers near the Kenyan border. The International Monetary Fund has released nearly $216 million for Senegal after a review of its aid programs for the country. The IMF revised down its 2022 growth forecast for the country to around 5%, while inflation is expected to reach 5.5%, driven by rising food and energy prices. The executive board of the International Monetary Fund said soaring global fuel and food prices, compounded by the war in Ukraine and to a lesser extent the freeze on trade with Mali, are disrupting the post-pandemic recovery. Now the Rwanda Stock Exchange Markets report of Rwanda. The trading session recorded a total turnover of 4,757,000 Rwandan francs worth of bonds traded in 3 deals on the fixed income market and 47,300 Rwandan francs from 1,100 I&M bank shares traded in 1 deal on the equities market. The equities market closed with I&M bank at 43 Rwandan francs, Bralirwa at 160, Bank of Kigali at 265, MTN Rwanda at 177, Simerwa at 120, Equity Bank at 440, Kenya Commercial Bank at 370, National Media Group at 1,200, Uchumi Supermarket at 104, and RH Buffalo closed the counter at 526 Rwandan francs. With that, we come to the end of tonight's edition.